So this is a session entitled, as you see on our slide, The Changing Face of Minnesota Communities, How Will Public Health Respond? This is the first of the school's 2008-2009 Roundtable series entitled Public Health 2050. We want you to stay tuned because there will be 2 subsequent sessions on that general theme in the spring of the year. And in Minnesota, we start counting spring in January. So let us know if you would like to have invitation or participation in those sessions as well. Each year, the Roundtable series is an opportunity for the school to explore timely topics in public health with all of you, our community. We try each year to bring these issues forward, utilizing research and practice and engaging knowledgeable experts in the field that represent academic partnerships, public health agencies, community organizations, and other private and public sectors. This year's series is an exciting opportunity to look ahead of us, to explore the key issues that some of us plan on seeing in 2050. If you've not done so, though, I would ask you to do a couple things for us on the logistics side before we move into the future. And that is, in the packets that you have been provided, you have a participation form. And that gives the school important demographic information and allows us to share with you new and upcoming events, such as our Roundtable series in the spring of the year. At the end of today's program, we also ask if you could fill out the evaluation form, because it's through those evaluations that we find out what you think the timely topics are and where you would like to see the school provide these types of efforts and partnerships. Please note that this event is being videotaped and will be broadcast online for educational purposes after this event. Your participation is considered consent to be included in the archived webcast. And as we always hear, please turn off your cell phones or put them on vibration as the videotape as well as our speakers will be responding, and we don't want to interfere with those types of broadcasts. We have a full program today, and we're really pleased by the panelists and our keynote speaker who has given of their time to come today. Our keynote presentation will be the state demographer, Tom Gillespie. Then we will have a 1-hour panel response with our 4 experts and a half-hour question and answer period, where our School of Public Health Dean, as well as the Director of the Office of Minority and Multicultural Health at Minnesota Department of Health, Mitchell Davis, will participate. Our moderator to the panel today is someone that all of us know as Mr. Public Health, Dr. Ed Ellinger, is Director and Chief Health Officer of Boynton Health Service and Adjunct Associate Professor in the Division of Epidemiology and Community Health in the School of Public Health. Without further delay, I want to introduce and ask to come to the podium our Dean, John Finnegan, who was the one who brought this topic to us to consider. As he knows, as well as I do, since we're the same age, that we'll not quite be 100 when we reach 2050. So being aware of and moving towards those issues of public health now, and looking forward to these activities as we all participate, both in today's session as well as to the solution of some of those issues. So Dr. John Finnegan, Dean of the School of Public Health.
Thank you, Deb. I lied. Actually, I'm a year older than you are. Good morning, everyone, and thank you, Deb, for that introduction. The School of Public Health for many years has sponsored the Public Health Roundtable events, and it's a way that we try to link the research that's done by our faculty with the work that's being done by public health professionals in the community and around the world, and also those decision makers responsible for making public health policy and turning it into action. Public health roundtables center on important and timely areas of public health. And in the past, as those of you who have been here before know, we have sponsored roundtables on adolescent health, on aging, on obesity, and on global health. Today's roundtable is part of the 2008-2009 series, and here we focus on the future of public health, which is impacted by us, who we are, what we do, and that in turn will have an impact on forming the future of public health for the generations that follow us. I think you'll find today's event to be a good way to kick off this topic, and I think that Public Health 2050 will be a topic that is rich with all kinds of possibilities. So much of public health will be different, and much will be the same in 2050. Technology is certainly going to drive some of the changes, and so will an increasingly smaller, more crowded planet. Today we face economic upheaval that I think will ripple well beyond 2050. And of course the political change and the demographic shifts are exciting and bring with them great opportunities and challenges for public health. Today we have about 6 billion people on the planet. By 2050, given current projections, we may be looking at about 9 billion people on our planet. So if you would think for a minute what some of those changes might mean for the future of public health. So it's 2050, it's mid-21st century. Children born today will be in their early 40s, and their children will live well into the 22nd century. In fact, if you're in this room today and you're in your early 40s right now, you will have a great chance of being around in the world of 2050. As Deb said, that will be my 100th birthday, and I fully expect to see all of you there to celebrate it, right here in this room. A few people in my family have been long-lived, and I thought I might use a little bit of looking backward before we look forward to give you a little bit of a perspective. I had the great privilege of knowing one of my great-grandmothers, Louisa Chase. She was born in northern Wisconsin to immigrant parents in 1862. She lived to be 98 years old, so I was 12 years old when she passed away. She was 3 years old when Abraham Lincoln was assassinated. When she was a child, Louis Pasteur and many others were already well down the pathway of a total reconceptualizing of biology through the concepts of germ theory. The phone was invented when she was a teenager. She used to say it was just in time. But in fact, she actually never used a phone regularly until she was well into her adult years. That's what living in rural Wisconsin of those days was all about. By 1900, the turn of the 20th century, she was 38 years old, she had married, her 3 children had been born, and the average life expectancy in the United States was 49.5 years. Now, amazingly, she was over 40 years old before the United States took its first public policy and regulatory steps to guarantee a pure food and drug supply. She was over 50 years old before she had access to those keystones of 20th century public health, modern sanitation, and water facilities. The acceleration of change during her lifetime was shocking. In 1900, the face of the nation was changing. The largest influx of emigrants in the nation's history were flooding in from Eastern and Southern Europe, fueling the rise of the United States as an industrial giant of global scope and influence. And when she was almost 60 years old, there were a huge migration of African American citizens that began out of the southern United States into the crowded cities of the North. In the next 60 years of Louisa's life, she would witness 2 world wars, the invention of the airplane, the rise of the automobile and the demise of horse-drawn transport, global wireless communication, radio, television, the computer, nuclear fission and nuclear weapons, global travel by jet, rockets, satellites, and yes, she lived to see the first human shot into space in Russia and in the United States. She lived to see antibiotics, the discovery of DNA and a second reconceptualization of biology, and countless advances in science, medicine, and public health. And she died in 1962. As the 21st century began, the average life expectancy had grown by 25 years to about 75. We have every reason to expect that the acceleration of change between now and 2050 will be equally shocking. And I fully expect that when we get together here in this room in 2050, we will reminisce about the change that we have seen, and I hope also be proud of the contributions that we might make to creating a world that will be just a little bit better than the world that we found. Now, one person who I think will help to kick this off and will provide some thought into what that world of 2050 might look like from the standpoint of our populations and communities is Mitchell Davis, Jr., the Director of the Office of Minority and Multicultural Health at the Minnesota Department of Health. MDH represents a large segment of the public health practice community in Minnesota, and by virtue of its size and its reach, it really has a bird's eye view of what the future will hold for the health of our communities and populations. It's no question that the role of the MDH's Office of Minority and Multicultural Health will take on even greater prominence as communities of color in Minnesota continue to grow in size and in influence. So as someone who is tuned into the roles that culture, race, and ethnicity play in public health and the delivery of health and human services, Mitchell Davis will certainly offer us a well-informed perspective on the changing face of Minnesota communities. Please join me in welcoming the Director of the Office of Minority and Multicultural Health, Mr. Mitchell Davis.
Well, good morning to each of you. On behalf of our Commissioner, Dr. Sandy Magnan, Minnesota Department of Health Commissioner, I want to welcome each of you. And our vision at the Minnesota Department of Health is to improve the health and to maintain the health of all Minnesotans across all 87 counties in the state. The Office of Minority and Multicultural Health, we, of course, work directly with all populations with a special emphasis on the populations of color and our American Indians and tribal nations. And our charge is to strengthen the health and wellness of Minnesota's racial, ethnic, cultural, and tribal populations by engaging diverse populations in health systems, mutual learnings, and actions essential for achieving health parity and optimal wellness. As I think about this topic, the changing face of Minnesota communities, how will public health respond? John didn't know, but I wanted to look back a while back in Minnesota, and then I'm going to just jump ahead a few years, but then leave several questions because our next speaker, who I will introduce, will begin that discussion. A friend of mine, when I moved to Minnesota from the East Coast, gave me a book called They Chose Minnesota, a survey of the state's ethnic groups. And this was written about a decade ago, and I want to share a paragraph or two with you. When Minnesota became a territory in 1849, It had a recorded population of 4,852. Lumbering had begun in the St. Croix Valley in 1839. And the hamlets that had become the cities of St. Paul and Minneapolis had been founded in the 1840s. In the 1850s, the number of settlers pushed into the ceded Indian lands, creating a population explosion of 2,831%, by far the highest rate in the nation at that time. When Minnesota joined the Union as the 32nd state in 1858, Minnesota had a population of 150,037 people. And listen to the people makeup who moved to Minnesota. A host of Irish carpenters and tavern keepers, Swiss and Welsh laborers, German butchers and cigar makers, English masons and Scot bakers joined farmers from Germany and Canada and some older areas of the United States, wagon makers from New York, hotel keepers from Virginia, lawyers and merchants from Pennsylvania, millwrights from Ohio, ministers, teachers, and tailors from New England, and French-Canadian blacksmiths to spread over most of the southeastern quarter of Minnesota. Although the growth rate has never again reached that type of growth of 2,831% back then, it still remains strong. I'm sure Tom will share more about that. Until the mid-20th century, over 50% of Minnesota's people were rural, 22% of them were engaged in farming, and then it goes on to say that each of the settlers who moved to Minnesota received 160 acres free as a plan to settle in Minnesota. That was a long time ago. And now I want to jump to now. We can take Minnesota, we can take any metro city, anywhere in the country, and here are some of the issues that we're working on. The demographic shift of more and more people moving, especially our racial and ethnic communities. Disparities and concentration of poverty. There's a wide gap, and it's widening between the haves and the have-nots. The regional growth machine. As we look as more and more people move out of the cities and move into somewhere more peaceful. Urban flight, racial polarization. School gaps between our students of color. Barriers to fair housing, environmental qualities. And health has a unique, because not only, certainly all of us are healthy, right? We plan to live way past 2050, right? Well, there's not too much, not enthusiasm about that. But I plan to live past 2050, and I'm enthusiastic about that. But we look at the health impacts, and we see, too, that there's also environmental impacts, social economic impacts that also we will invade and impacts upon us. Transportation issues, air quality, and, of course, public health. Energy consumption and political disorder and zoning and land use, all of those issues were back in the 1800s. They're right here with us now. And unless well, then again, we're at a place of learning. And so those of you who are continuing your study in big ways are going to solve all of these problems by 2050. There's no doubt about that. Right, Dean? But as we look at all of those issues, certainly we don't have immediate answers, but it takes all of us working together to bring the answers and solutions to those. And just like Minnesota was welcoming back in the 1800s, Minnesota must be welcoming in 2050, must be welcoming today. We have challenges, yes, but certainly that same spirit of saying we must bring all together, that must evade in all that we do. Now, I only can speak for one, myself, but each of us must speak together in one voice to make sure that we can have a more welcoming environment. Now, basic to any effort to discern the trends in the movements of all people, but in particular, our racial and ethnic populations or tribal populations, there must be data, there must be trends, there must be discussion around that, because there's many, if you don't show data, the problem does not exist. I believe there's two balances, the story of data and the data of stories. And both of those must combine to tell the real story.